Good afternoon. Welcome. And I am going to pass it right over to Marco so we can get started. Thank you.
Thank you, Sherry, and good afternoon and almost noon, everyone. Can everybody hear me okay? Yeah, I see some heads shaking. Great. I am Marco Giordano, your CEO, and I appreciate everybody joining us again this week on our COVID call. And I hope everyone enjoyed the Super Bowl weekend and the weekend at the Super Bowl. Congrats to all the Buccaneer fans that are out there, and to the Chief fans. Well, there's always next year. That's something us Eagles fans here in Philadelphia have been saying for a few years. So congrats, Buccaneers. So watching the Super Bowl last night, it reminded me of our Values Day, and wasn't that long ago. Hopefully it's still in the memory of many of you. And our virtual celebration that we have for our own internal heroes. So on Values Day, I shared some thoughts that I wanted to share again today, coming off of Super Bowl weekend. So on Values Day, I shared this thought. Every day our staff show up, ready to tackle the challenges, to run the yards and accomplish goals in support of the folks we serve and each other. Our staff do this often thankless work without thought to winning or losing, but to ensure that they impact the lives of those they support better than they did yesterday. While the field looked different this year, and at times the season seemed short, our staff made the impossible possible. Today, I thank you for your commitment, care, influence, and impact on the individuals we serve. In true RHD spirit, we have not just one MVP, but each and every one of you are RHD's most valuable players. Heroes play here for sure. Heroes powered with kindness and compassion. Those are the words that I shared on Values Day, and they so still ring true. Every day, the RHD community, our team, works together to support each other and the people we serve. We all have a position on the team. We each bring value on and off the field. And while there are many of us on the team, we each bring something a little different. We are creative and continuously think through strategy and approaches to ensure we are providing a safe, healthy, and supportive environment for the folks we serve and each other each day. This is not easy work. We are human beings. Each of us are flawed. Each of us are flawed. We are also caring for human beings who trust us and rely on us each and every day for care and support. So as a result, we follow the necessary rules, but we also challenge ourselves to question, to have curiosity, to ask why. We do this all while focusing on supporting our own well-being and our families, our friends, and our loved ones. I share these thoughts with you because I really wanted to focus today on some words of appreciation, appreciating all that each of you are doing during this time, doing not only for the folks that we support and each other, but for yourselves and your families. And, acknowledging, in my written words here, I have wow, because that's at times how it feels from my lens. The impact and influence we all have on the lives of so many individuals. Each and every day we are presented to make what seems impossible possible, and open doors for new possibilities for the folks that we support. And no doubt that this year, or during the past year, this could not ever be truer. So I wanted to focus my thoughts with you all today with simply thoughts of appreciation, appreciating all that you do each and every day. And I thank you all for what you each do to ensure that we are resources for human development. Thank you. Sherry, the mic is yours.
Great, thank you, Marco. And Hannah's going to pull up the agenda. Excuse me, with, thank you, Hannah. Yep, for the first page, Hannah, with the, yep, yeah, thank you. Yeah. All right, so we do have lots of team members on today, some that we don't always get to hear from. So we'll have our COVID-19 update from Brian. The vaccine committee, Sheena, is here. So I'm sure that's one we're all looking forward to hearing the latest. We have Outside the Line Studio. So I just learned that goes by ATL. We have our own Cynthia Barnes, and she's going to be presenting some of the creative things happening in her world. And then we also have the consumer survey report, and that will have team members Emily Spector, Marvin White, Susan Hunt, and of course, Sandy Cox Sales. So that should be another interesting presentation. And then we'll, as usual, move into the open Q&A and finish with some closing remarks from Marco. As always, we encourage you to submit your questions either through your voice, the COVID-19 inbox, or the Zoom chat. So please bring all your questions to us today. We do appreciate that. And then always the reminder of Helping Hands. Christy's email, Christy Katz Freeman's email is on the bottom. And we want to keep encouraging people to use Helping Hands. It's been a long time that we've been at this. So that's a great resource. All right, so Brian, I am going to pass it over to you for the COVID update. And Hannah, thank you for showing that again.
All right. Thank you, Sherry. Good afternoon, everybody. My name is Brian McHale. I'm the safety manager, and I'm here to share our COVID-19 summary to date. So since March, we've received 2,396 reports. Of those reports, we saw that 662 were for confirmed cases of COVID, 976 were for negative cases, 102 for suspected, and 655 for possible exposures. So what I'm going to do at this time is I'm going to share with you our bar graph that we've created using all of this data that we've received since the beginning of the pandemic. And what you're going to see is a downward trend that we've been tracking since the beginning of January. And you can see as we've gone further into January, now into February, that downward trend has become very dramatic. And this follows along with some national numbers as well. So the national trend has declined. We're looking at 30% less cases over the last 2 weeks. And like I said, we're kind of following along with that, which really looks like a sign of progress, over the last few months. But really, at this time, we should really be tempering our optimism with caution and really doubling down and making sure that we're staying vigilant and doing our part to slow the spread of COVID-19 by following the 4 Ws. And I know we've brought this up several times over the last few town halls, but it really is important that we continue to do it. Wear a mask, watch our distance, wash our hands, and wait on gatherings. So, one of the things we'll be doing over the next 2 weeks is really looking to see if there has been any uptick in the number of cases being reported to us due to the Super Bowl. I know, we've talked about Super Bowl possibly being a super spreader event with gatherings and the like, but, we're hoping that everybody took to heart some of the communications that went out prior to the Super Bowl about waiting on those types of gatherings. So, really, the one thing that I think really bears mentioning is that, now more than ever, we really should be adhering to CDC guidance and RHD's protocols. We don't want to lose any of the progress that we're seeing through the month of January. So we just really want to make sure we continue in this positive direction. Sherry, that is it for me. I'm going to turn it back to you, and I'm going to unshare my screen. Thank you, everybody.
Thank you, Brian. And then I'm going to ask Sheena to pop on for an update from the vaccine committee.
Good afternoon, everyone. Hope everyone is staying safe and warm if you're in a region that received the snow over the last week. So I do have a few updates from the vaccine committee. Just nationally, I'm happy to report that RHD staff and consumers in almost every region we're in, not all, have received access to the vaccination. So we still are working in a few regions that are still waiting to receive access in our designated phases. That includes our staff and consumers. One update I wanted to give as staff and consumers are receiving the vaccinations, just in program directors, unit directors, and regional directors, just be aware of, if you are aware of when they're receiving their vaccination, um, of scheduling purposes. It is being reported of different side effects with the doses. So we just want to make sure that, if at all possible, the stagger staff when receiving their doses. As always, remember proper um, identification when you go to get your vaccination, um, and to ensure that you checked, ensure you get your confirmation, ensure that there's been no rescheduling. For our Philadelphia area folks, I am happy to announce that FPCN has started their vaccination clinics. So we are partnering with FPCN to get our staff and consumers who would like the vaccine vaccinated. So many of our Philadelphia area folks, and when I say Philadelphia area, I mean anyone who has access to get to this area to get a vaccination if they want one. So most of our folks, if not all of our folks in the Philadelphia area, unit directors, regional directors have received emails from me with links to register for specific dates and times for the vaccination. If this is something that you have not received, please reach out to me so I can ensure you have that information. We had designated for our frontline consumers, those in the 1A, 1B, and high risk phases population, um, to be the first to be the first to have access to it. However, we do not want to waste any of the doses we have available. So if we do not fill up those clinic times, if those schedules do not fill, we will open it up to more staff and consumer, or all of our consumers, but to more staff. So if you are in the Philadelphia area or have access to this region, means to get here, and you have not received any information about that, please reach out to me. We will have further information. The process will change in the future. We just had to work with our FPCN's EHR, their scheduling and portal, to get it kind of ready for us to use it. So that's why we're doing it a little bit differently for these first few clinics. Again, this is specific to those who are going to the FPCN clinics. Just please be aware for programs, if you are bringing large groups of other staff or consumers, be aware that space is limited. We are still strictly following COVID protocols and social distancing. So unless you are at your appointment time and you are and you are in clinic with a provider, please try to wait in your vehicle. If you have a vehicle, where that applies. We want to make sure that we are following social distancing guidelines. In addition, please do not reach out to the health center directly to get an appointment to schedule your vaccine. If you have any questions about that, please reach out to myself directly. I'll put my email in the chat for everyone to see. But please reach out to me. We do not want to inundate the health center with a bunch of calls and emails, because they are, in addition to the vaccine clinics, they still do have their regular practice that is up and running. Okay, I think that's it for that. But Nina, remind me if I missed anything. Okay. So in addition to all this information, it's really important that we want to provide everyone with education about the vaccination. So there is a link that will be shared in the chat. It's a video to Dr. Fauci's visit to Arena. If you're a sports person, it's NBA related. I know nothing about sports, nothing about the NBA, but he visited the Arena, which is a show on TNT, to just provide some information and education about the vaccination. So we will provide the link for that in the chat. If anyone has any questions about that, please feel free to reach out to me so we can get you connected to a proper clinical professional. My last update, if there are any programs during staff meetings or any people at all who just want some more information from a clinical professional about the vaccination, about COVID, please reach out to me. Rebecca Bixby and Nina, I might be volunteering you for this, have agreed to be there to provide information and education to our staff and consumers. So if there's anyone who would like some additional information or would like a clinical professional to join them for a staff meeting with their staff, please reach out to me and we can get that coordinated. I think those are all of my updates. If anyone from the vaccine, if I missed anything from the vaccination, mixed anything, someone from the vaccination committee, send me a chat and I'll let Sherry know. But I think that those are all my updates.
Thanks, Sheena. That's a lot. So I'm going to just to clarify for myself, if we have questions or need the link, reach out to you. And if we want further education, to reach out to you. Are those like the two main?
Yes. Any in general, any vaccination questions you have, you can reach out to me and I'll be sure that if it isn't directed towards me, isn't something for me, that I'll get it to the appropriate person.
Okay. So can you put your email address in the chat along with the link? Great.
Can I just jump in for 1 second?
Sure.
Hi, I'm sorry. I'm Sarah Reed. I'm on the, I do internal communications at RHD. I'm also on the vaccine committee. I just wanted to point out that the reason that we are only doing this vaccination set up for our staff in Philadelphia with FPCN is because we only have FPCN health clinics in the Philadelphia area that are doing this. So if we had FPCN or those types of health centers in other parts of the country, we would be doing the same thing. But unfortunately, right now, this is the only place we're able to provide that sort of very specific connection. So I wanted to make it clear for those folks who maybe are not in the Philadelphia region and maybe aren't super clear on what FPCN is.
Thank you, Sarah. And I just also want to add that they conducted their first clinic on Saturday and it went extremely well. We have a list of people who are able to register for the clinic, and we also have a standby list of folks that don't get specific appointment times, but if there are cancellation or no-shows, we're able to pull from that list and call them day of and say, hey, can you make it in to register? One more thing to point out. If you do get an appointment time, please do not bring your spouse or family member to your appointment with you, hoping that they can get the vaccination. If and when the time comes and we have the availability to open it up, we will let you know. Please don't reach out to FPCN. Please don't bring more people with you. We're trying to be as coordinated as we can with this effort, and that's to ensure that everyone who registered is able to get the vaccination, and we're following proper COVID protocols.
Great, Sheena. So I'm sure we're going to have more questions, but we'll get to those at the end when we do the Q&A. All right, we now have Cynthia Barnes to give us our stories from the field. So let's just give us 1 moment, Cynthia, to get your presentation up. And then we'll kick it over to you. Hannah, if you could pull that up now. Oh, I'm sorry, Cynthia. No, you're doing your own. My bad. Sorry.
That's all right. All right. Hello, everyone, and thank you for taking the time to join us today. I'm Cynthia Barnes, the Program Director of Outside the Lines Studio. I know that there are noteworthy innovations throughout RHD, but I'd like to take a moment to share with you a few of the amazing things OTL staff have done to maintain quality service during a very unusual and challenging time by thinking outside the box and outside the lines. Outside the Lines is a community-based day program that provides services for 29 adults with disabilities. We use the arts to help individuals explore their own unique potential in a way that best suits their interests, talents, and learning styles. COVID-19 not only caused the day program to close, open for 2.5 months, and then close again, it had a detrimental impact on the social and emotional well-being of the individuals we provide services for. Remote services began as a way to financially maintain OTL and continue to provide services to participants. However, we soon realized that virtual programming was also a way to address the pandemic, the impact of the pandemic by creating opportunities for individuals to address their social and emotional needs. Both staff and individuals reported that remote services gave them a reason to get out of bed each day. One individual in particular often shares his enjoyment of how they can explore the world through Zoom from the comfort of their bedroom. At first, we offered opportunities such as one-to-one Zoom sessions and phone calls, but this was soon expanded to include group activities as well. We connected each individual with remote services based on the technology they had available and what would work for their needs. One-on-one sessions allowed individuals to explore their unique interests with the support of a staff person's undivided attention. This remained the best service option for many participants, especially those who struggle in group settings. However, many folks thrived in Zoom groups that provided a safe space for them to maintain connections through shared experiences and activities. We also called participants who did not have access to Zoom supported technology on a weekly basis to maintain connections with them and make sure they had everything that they needed at home. Not surprisingly, activities that provide opportunities for expression seem to be the most popular way individuals like to spend their one-on-one Zoom sessions. Some people like to share the art that they've made over the weekend or try and make their own digital art during the session. Others like to create illustrated stories, both from their imagination or based in real life. But a few are willing to try something new, like animation or comic book making, like this little snowman dude here. Luckily, at the onset of the pandemic, online games, activities, and tours became readily available to support virtual learners. OTL staff keep a big spreadsheet full of links to online activities to help engage folks during Zoom sessions such as Mad Libs, virtual museums, aquariums, and zoos, as well as virtual tours of iconic landmarks and wildlife parks. We offered 2 Zoom morning and afternoon. We try to include groups similar to the ones we would have provided on site at the day program to help provide a sense of normalcy, but we added new groups as we learned more what the individuals like working on Zoom. Pet Party started off as being about pets, but soon became more of an animal appreciation group as we ran out of pet-related activities to do. Along with animal trivia and other games, we often explored live webcams of animals at zoos. We also encouraged participants to add drawings to the such as the platypus is sleeping. Maybe he's bored. What could we add to help him have more fun? On site at OTL, we have a big community art table where people can make art together and socialize. We tried creating a similar experience on Zoom with a community art group. Participants in this group can collaborate making art digitally, or they can work on their own projects using materials they have at home. Most choose to work on a digital project, but every now and then we have someone working at home with their own materials. We often use prompts or a theme of the week to help individuals decide what to draw. At the beginning of January, the couple of prompts that we used was draw what brings you joy or what makes you feel hopeful to help bring in the new year in a positive way. Creative writing groups often by drawings we've made in community art, but sometimes we just make art to go along with the story that we've made. Here's the most recent example from Creative Writing Group called Dinosaur Valentine's Party. It includes amazing things like a T-Rex doing the mashed potato, a pterodactyl doing the twist, and a one-eyed, one-horned, flying purple people eater doing the Watootsie and the Boogie Woogie. It is one of my favorites so far, and I have no doubt it'll be your favorites as well. Along with remote services, we began delivering art kits to day program participants every couple of months. So far, we've delivered 4 kits, with another one coming up for Valentine's Day next week. It not only became a way for individuals to get materials they needed at home, it gave everyone a break in routine and something to look forward to. The kits that we delivered over the summer included an inspirational coloring book made from drawings created by OTL artists. The Halloween art kit delivery was especially noteworthy. Staff dressed up as a clown to deliver pumpkin decorated to everyone, including individuals in hospitals and rehab centers. None of it was easy. None of it would have been possible without OTL's amazing team, but all of it was worth it. So please don't hesitate to reach out to me at Cynthia Barnes at rhd.org if you want to learn a little bit more about what OTL worked on and how you might be able to do something similar in your program. Right, thank you.
Thank you, Cynthia. That's really fantastic. I see lots of hands clapping, so you might want to put your email address. I know you said it, but you might want to put your link in there so people have it and can reach out to you for more information. Great. So this time, Hannah's going to pull up the presentation and we are going to kick it off. Sandy and Marvin are going to give us an introduction, and then Emily and Susan will walk us through the details. And this is the consumer survey. So Sandy and Marvin, I'm going to pass it over to you.
Okay, good afternoon, everyone. I don't know if Marvin's on. Marvin, are you on?
I saw him on, Sandy. Let's see.
Marvin? Okay, he's, it's fine. What we wanted to introduce to everybody today is the results of that, the residents survey that we did, where we were asking the participants or the residents, how are they dealing with COVID? I know that as staff, we talk about it all the time. We have these meetings, and we have all since the beginning have been able to have conversation about, how this pandemic is making us feel and what changes that we had to put to our life. How is it affecting our families? How is it affecting, just in general, our mental health? And so I believe you all probably know, because the surveys were given out across the corporation. And it was a short survey, but it was asking very poignant questions about how folks were dealing with the pandemic. So I do think that it was imperative, even though, it took us a while to get all of the results. I do think it's timely and imperative that we did this for concern for the people that we're providing services to. So I'm gonna. Oh, Marvin is here. Okay.
Yeah, I'm sorry. Good afternoon, RHD. I'm sorry for my computer's messed up. I've been on IT trying to get it fixed. I want to thank everyone that has been a part of putting the participant COVID-19 survey together and presenting it to the participants from the regional level to the unit directors, and most importantly, the CPSs, DSPs, and LSCs that's been actually working in the sites. We appreciate you all. RHD has tons of trainings and different resources for our employees surrounding COVID-19 and the importance of self-care. In September, October 2020, this was before the vaccine was even an option. RHD wanted to see how our participants was dealing with the pandemic and how we could better support them. Meeting after meeting, we put together a participant COVID-19 survey. We wanted the participants to know that they matter and they also have a voice too. So in December, RHD rolled out this survey to all the behavioral health and housing division programs. We are also moving forward to other service lines with a similar survey in the near future. The survey was totally anonymous, and I believe we had a great success with the survey, receiving a 25% response rate from the sites. All data has been collected and sent back to the directors. With this data, we can now see how RHD can move forward and better address our participant needs and concerns. With that, if Sandy didn't have anything else, I'm sorry.
No, I don't. Yeah, no, I think that was very well said, Marvin. Thank you.
Are you walking?
We can move this to Emily. Yep.
Great, thank you, Sandy and Marvin. And just to echo what Marvin said, thank you everyone for your help in gathering the data. We really appreciated that. I know a lot of folks on this call had a hand in making the survey happen. So I'm just gonna go ahead and run through the results and then Susan's gonna provide just a little bit of information about how you may want to use this information with your program participants. So next slide. Okay, so the first thing we wanted to ask about was how your being affected since the pandemic. So as you can see, the highest response was that COVID-19 affected participants' social lives, and this is followed by their mental health. Attending support groups, their finances, employment, and obtaining healthcare were also checked by at least 20% of participants. And this was followed by physical health and getting other services such as food or housing. And as you can see, only about 10% said it affected their ability to obtain medication. This may be something that programs who had participants that did check this might want to just look into at their program level results. So next slide. So this graph shows the percent of respondents who stated they were worried, scared, sad, concerned about their physical or mental health, concerned about their substance use disorder, either a little or a lot more since the pandemic started. So another way to view these results would be that over 60% of respondents are at least a little more worried since the pandemic began. About 50% are at least a little more scared, and so on. These results point to the overall anxiety that our participants have been dealing with since the pandemic began, as Sandy stated. And I'll actually speak to the lower percentage of substance use disorder responses in a few slides. So next slide. So I'm going to run through the next few slides sort of quickly. These just give a little more detail on these questions about how participants may have felt since the pandemic began. But I'm happy to answer any questions about these slides that anyone has, and we'll also be sending out the deck. So feel free to peruse these data on your own. So again, these slides just provide the full responses to the question. Please indicate how you have felt since the pandemic began about the concepts that we asked about. Here you can see the data when asked about feeling scared. Next slide. Here's the data when asked about feeling more worried. Next slide. Feeling more sad. Concerned about physical health, concerned about mental health, and finally concerned about your substance use disorder. And then this slide, we just went ahead and broke out the question around folks who were concerned about their substance use disorder, just because so many individuals responded not applicable. We wanted to break out the responses, taking those responses out. So with NA taken out, about 35% of respondents stated that they were at least a little more concerned about their substance use disorder. Okay, so the next question asks participants about some safety rules that programs put in place since the pandemic began. As you can see, almost 40% of respondents said none of these were difficult to manage. However, note that this includes respondents who may not have dealt with these rules, such as respondents who only received care via telehealth since the pandemic began. The most common rules participants had difficulty managing were mask requirements and social distancing. New cleaning procedures were reported to be the least difficult to manage. Next slide. So this slide just breaks out the data from the previous slide, but it does so by outpatient, mobile, and ACT service lines versus residential. This slide offers a little more detail around the challenges participants at our various program types have had in dealing with the new safety protocols. So we also asked participants to provide some information on ways they have conducted self-care since the pandemic began. As you can see, less than 10% stated that they have not practiced self-care. The most common responses were watching movies or TVs, listening to music or lectures, and connecting with family or friends via Zoom or another technology. Some respondents also filled in their own ways to practice self-care, and here you can see some of the more common responses that we received. Finally, we asked some questions on telehealth, given the huge shift towards telehealth at the start of the pandemic. As you can see, over 80% of respondents stated that they have received care via telehealth since the pandemic began. Note that this could include telehealth provided outside of RHD, as well as telehealth provided as part of their RHD services. So it's any telehealth that a respondent may have received since the pandemic began. Next slide. Oh, no, sorry, this slide. Here you can see how respondents responded to the question of how would you rate your overall satisfaction with telehealth. Over 70% stated that they were either somewhat or very satisfied with telehealth. Less than 10% said they were dissatisfied. Here are some of the comments respondents provided on telehealth. And as you can see, there are some positive comments, but also some negative comments, both very helpful and informative. As you can see, there are a variety of comments provided on this feedback. So we might use this feedback to inform additional data collection around telehealth, such as potentially through a focus group, as we continue to think about the ongoing role of telehealth in RHD services and how we can best support our participants through telehealth. And then finally, here are some more of the comments provided by participants. So this is just a cross section of the feedback that we received. As you can see, respondents gave a variety of answers when asked just sort of generally about their feelings. Note that this survey was done before the vaccine, as Marvin mentioned, so I did not include the vaccine-related comments here. So we're happy to answer any questions about the survey. And now Clinical Director Susan is going to provide a little information on using the survey results at your programs.
Thanks, Emily. Yeah, as Emily pointed out, our participants are describing they've had a lot of worry and fear, anxiety and frustration, and certainly making sure people are connected with their supports, therapy, substance use treatment, medical, physical care, of course, is important. But what's also important is what we're doing on a day-to-day basis in our interactions with folks to sort of help them through. And the first step with really everything is validation, validating where people are coming from. You know, that it makes total sense that a person would feel worried or frustrated with masks or lonely because of social distancing, just the same as most of us have been feeling too. So the strategies we need for managing and coping with those feelings are not really different. They're really the same kinds of things we've heard about from a lot of different places in this last year. But it has been almost a year, and COVID fatigue can often mean that we sort of drop a lot of these things by the wayside that have helped, and the same goes for our participants. So I'm going to spend a minute or two on a couple of general strategies to think about as we help our participants with their emotions right now. The first strategy is to really recognize that we probably all need a tune-up by now. So many of our programs and staff have done an unbelievable job this year, not only keeping people physically safe, but helping people cope with a lot of difficult emotions. Even so, it could still be a good time to sort of tune up by taking a fresh look at what strategies you've been doing and maybe what we started to do over and over again that maybe have gotten a little stale for some of our participants. So one way to tune it up is by changing it up and adding something that's really unexpected and maybe brand new for a person to help them sort of refocus on their emotional wellness. So one thing that you may want to try, and this came up in one of our open door meetings, is to try something like a seasonal affective light. Or in other words, it's called a sad light. So for any of you who are not familiar with this, these are lights that mimic the sun. And they're about $20, $30, and it's not going to do any harm. But for somebody who has had, not able to get outside as much as we'd like to this winter, a light like that could make a huge difference for somebody who's had to stay indoors for a long time. So that's just one idea, but keeping it creative is a great idea this time of year, and that's tune up. The second,
can I show folks what?
Of course, yeah, Sandy. Cool.
This is one of the examples of one of the lights that you can sit under for 10 minutes each day. So just want to show you what it looked like. Very small, very portable.
Hey, Sandy, when you say you sit under it, what do you mean? How does that
work?
I
sit beside it.
Cool. It's really
and it mimics the sun. Good old vitamin D.
Yeah,
right.
Cool.
So.
And there's more information, more and more coming out about how it's really helpful to sort of improving the depression that a lot of us can feel in the middle of winter when we're not really getting outdoors as much. So thank you, Sandy. Yeah, the second strategy, so that's tune up and do some new things. The second strategy would be to get up. And to sort of get up and incorporate our senses and our bodies in small doses throughout every day. These two things, our senses and our bodies, speak straight to the emotional centers of our brains. And I know we have thousands of participants with thousands of unique and individual needs, but in general, using your senses and moving your body are two of the most effective ways of improving mood and managing anxiety and reducing depression, along with a host of other physical health benefits like better sleep, digestion, memory, improved memory. So, who doesn't want that? And research shows now, and I thought this was cool, that really short little bursts of movement and activity during the day, as little as 2 minutes at a time, can give you the same significant health effects as longer periods of time during the week. So some ideas are to help participants think of things like exercise snacks, moving, rocking, bouncing on an exercise ball, balancing, taking a walk and talk, having a 5-minute dance party, moving throughout the day in these short little bits are really healthy for you, and we can make it fun. Working in our senses is another strategy that is also really helpful in doses during the day. So you can think about getting some like essential oils. Most supermarkets have these now. Citrus is grounding for people who have had trauma. Peppermint is energizing. And using other senses too. So really just playing around with folks. For some people, using a weighted blanket and sitting in a rocking chair, or getting like a big thing of clay from one of your local Michaels or a craft store and just putting that on the kitchen table to mold or punch your fists into can be super duper helpful to them. So you want to think about how you can adapt these ideas to your specific service type. So in a residential environment, that may mean actually creating a room or a space for somebody where they can have access to these materials. If you're mobile, in a mobile team, that this way you may be helping someone by helping them to develop their own personal toolkit. So sensory items they can carry in a fanny pack, or wallet cards with movement reminders that they can do. So there's lots of ways to incorporate this and encourage people to use it. So these are what we call sort of the bottom up, or I'll say the body up kinds of strategies to help with our emotions. The flip side are the top down. So those are the strategies that help us with the way we think about things in our lives. So our thoughts create feelings, and our feelings often drive our actions. So when folks are worried and anxious and depressed, it's like they have one foot in the past, feeling bad about that, and one foot worried about a future that they can't control. And what that means is that you're never really in the moment, in the present, and you're sort of kind of just getting tossed around on the waves of your own thoughts, which only causes more anxiety. So the first way to sort of take hold of our thoughts and get more control is mindfulness. To me, mindfulness is sort of the glue you need to hold it all together. And mindfulness is being taught everywhere. In schools, actually, it's being taught, and we're now seeing that it's reducing the number of detentions and suspensions for kids at school. It's being taught in hospitals, human services, businesses, all over the country. And practicing mindfulness is simply bringing yourself fully into the moment that you are in by paying special attention to things around you or the sensations in your own body for just a minute. Helping folks practice mindfulness can be very active. It doesn't necessarily mean that you're meditating. So it could be helping someone to just pay attention to 5 things around them that they can see, and 4 things that they can touch, and 3 things that they can smell for a moment. Or even balancing a pencil on your finger and being aware of the little movements and balance that you need to keep the pencil from falling. We're mindfully eating and slowing down and actually sensing the food and its texture and its taste. These are all ways to practice mindfulness. And mindfulness teaches us that if I can kind of get out of my head and pay attention to one thing in one moment, then I actually don't need to be a victim of my own thoughts, but I can take more control over them. And that's real important in anxiety, especially when we're fearful and worried about the future. So last thing, mindfulness is totally portable. It's free, and it can be done anywhere, anytime. So no matter what service you do, there's no special space or tools, and it's a really effective especially with worry and the kinds of fear that our folks may be dealing with. So those are just a few sort of bottom up, top down mindfulness strategies to think about and how you might apply them with the folks that you're serving. And there's lots more too. So I just want to end with a few resources just be on the lookout for. So every month we have a DSIC team care package, which you may have seen. It's a little envelope that you can sort of open up virtually. It has Leah's activity lists in it. I'm going to throw in more strategies and ideas with working with your participants, as well as tips that we've put out before. We're going to put them out again to help motivate folks to wear masks and cope with social distancing. If you can send us stuff that you're doing, we'd love to hear it so we could continue to put that out for everyone to benefit from. And we will definitely shout out to any program that's doing that. Looking at Christie's wellness offerings, which are designed for staff, but you can take away great ideas for yourself that you can also use with participants. Our open door hours, same thing. You can take away ideas for yourself that you're also using in the programs. Using technology when you can. So many of our participants have smartphones. So there are great apps that you could use like Bloom or Breathe or something called Provider Resilience. And those are either free or low cost that do a lot of the things that I was just talking about. And the DSIC team, again, is working to help with supporting programs and trying to do more and more of the integrative kinds of approaches, some of which I touched on. So we are here for consultation and support if you would like to reach out to any DSIC member to learn more about music wellness, sensory movement, and more. So I think that is over my time. So I want to make sure that I send it back to Sandy and Marvin.
Yeah.
And Sherry, if there's any questions or anything you want to add.
Thank you, Susan. I just want to thank Emily and the outcomes team because they've done fabulous work on this with us. I wanted to also thank Marvin. He is the CPS coordinator for really staying with this survey and making sure we got some good results. So I hope this has been helpful for everyone. And if there's any questions, please don't hesitate to ask. I'm going to pass this to Marvin. Did you have anything else to add?
No.
Okay.
No.
So I'm going to send this to Sherry, back to Sherry.
Great. Thank you, Sandy and Marvin and Emily and Susan. That was great information. I certainly took out some things around COVID fatigue. So I think we all think about, right, if we're going to serve our consumers well, we have to be doing our own self-care. So thank you. We can use that on both sides. So we do want to open it up to questions. And if we want, we can start with questions right on this topic first, and then we can move to some of our other questions. So I haven't fully been paying attention to the chat, but remember, put it in the chat, use the raised hand function, and let me check in with Sarah and Hannah. Do we have any questions on this topic? We could start right here.
I don't have any questions about this particular topic. Hannah might.
And Hannah? And again, people can, raise the hand and ask their question with their voice as well.
I don't have any questions on that topic either.
Okay. All right, so let's move into our Q&A. Sarah, start with you today.
Yep, I have a couple regarding the vaccine. The first is, as more of our population and staff are being vaccinated, and we begin moving towards reopening programs, offices, and facilities, how are we going to handle those clients and staff who have not been vaccinated? Will they continue participating virtually, or will there be guidance in the future?
Well, from a clinical standpoint, for me, it depends on whether or not we've achieved herd immunity around this. And we won't know that until we have enough people vaccinated and there's enough studies done on it. But I don't know how you guys will handle that from a program standpoint. Because as of now, nobody's making it mandatory to be vaccinated.
I think from a programmatic standpoint, we would continue to assess the situation, getting feedback from both internal and CDC sources about best approaches, and would have to say we would take it as we move forward. So we certainly would be as cautious as possible and follow all recommendations from our experts.
Okay. Does anyone else want to add to that? Okay, I'll move on to the next question. And this is probably something for Sheena. Are shared services employees able to get the vaccine at FPCN? What about our families if they are in high-risk categories?
Oh, for the first part of the question, yes, shared services employees are still within those 1A, 1B categories. Are shared services employees that are front facing, coming into the office every day, or at high risk, are on the same level as all of our employees that we tried to get to the front of the line to get the vaccine. But as we open it up to all staff, of course, shared services employees are in that category as well. And if you have not received information to register, please reach out to me so I can get that to you. As it pertains to employees, high-risk employees, I'm sorry. As it pertains to high-risk employees, they should still utilize, registration links available, throughout the cities or locations where they live. For FPCN's our vaccination clinics, right now it is only open to RHD staff and consumers. When the next phase of that opens up to the public, we will let everyone know. So your family members or whomever will have the opportunity to register. But right now it is just for RHD staff and consumers.
Thanks, Sheena. I don't have any more questions at this time.
Can I just make a few statements about maybe clear up a couple of misconceptions about the vaccine? Do you have time for that? So one of the misconceptions is that there's a waiting period, 90-day waiting period, which has been cleared up if you go onto the CDC website. You only have to wait 90 days to get the vaccine if you have received monoclonal antibodies or convalescent plasma. And this is usually a treatment given to someone who has had COVID and has been hospitalized in the intensive care unit. So this does not apply to most of the population who will receive the vaccine. If you had COVID-19 and recovered or currently have COVID-19 and have symptoms, you would just wait until you're out of your isolation period and asymptomatic, but there is no delay period for receiving the vaccination. There's also been a question of the vaccine causing Bell's palsy. I've heard this one going around on Instagram and Facebook. You're more likely to get Bell's palsy, which is like partial facial paralysis from an everyday virus, including anyone who has history of cold sores. If you just get a regular cold virus, you are increased risk for developing Bell's palsy. There have been reports that handful of people who received the vaccine developed Bell's palsy, and the research suggests that they don't think there's a link between the two. So again, you're more likely to get it every day, just getting any other type of virus than from getting it from the COVID-19 vaccine. It is a temporary condition, usually lasting a few to several months, and then it resolves. Rarely does it ever become a chronic thing. And usually in that case, there's a family history of Bell's palsy. So those are the two things I just wanted to throw out there.
There's a question in the chat too that while you're chatting with us, maybe you could answer. Is there information on how best to inform and encourage folks who are resisting the idea of vaccination? I know many who are resisting.
I think the more that people become vaccinated that look like them, who live in their circles and that they see are okay from the vaccine, then they'll be more willing to get the vaccine. Some people, no matter what you do, if you offer them $1,000, they're not going to get the vaccine for whatever reason. So I think, so for me personally, I was very hesitant about getting a vaccine. I don't know if I shared that with you guys before, but with doing the research, I ended up getting a vaccine, and then my family soon followed suit. A lot of my colleagues in the clinic who were hesitant, who are people of color, followed suit. And then more of those people who got it and saw that everybody was okay. And then with the second dose, I got my second dose on Friday. That made more people less hesitant. So I think the more people get it that live around other people who are hesitant, and they see that, no, I didn't get Bell's palsy. No, my arm didn't fall off. I didn't grow a third eye. Whatever, people are saying is going to happen with the vaccine, the more people see that those things are not true, the more comfortable and confident they will be about receiving the vaccination.
Great, thank you. I'm just going to ask you one more question. Are there any other rumors that are out there that you can address, since that seems to be the kind of the latest thing happening?
So the only other thing is, I've heard people say, well, I had COVID-19, I have natural immunity, I don't need to get the vaccine. Yeah, so getting COVID-19 does offer some natural protection, but we don't know how long that protection lasts. And we know that people can get it again, and that puts you at risk for, severe illness and even death. And as far as the vaccine, as long the studies are continuing to go on, they're starting to see that the vaccines are offering longer protection against the virus than previously thought. They're still not saying how long, but they don't think that we're going to require a booster shot as of yet. There's no evidence that we require a booster shot after the 2 doses.
So there's a little more in the chat. I'm imagining there's not much information about long-term effects yet, but that seems to be a concern. Is there anything you can speak to on that topic?
Yeah. So once you receive a vaccination, typically the vaccine only stays in your system for a few weeks until your body develops the antibodies. And then once that's over, the vaccine is done. You're just left with antibodies that are part of your own natural immunity. So we know that there are some long-term effects from the coronavirus and I think I spoke to this before, with people having chronic pain syndromes that they're developing from having been infected with coronavirus, long-term lung issues, cardiac issues people have as a result. And these are young people who were relatively healthy before coming out, from this disease with long-term sequelae. So there's not a lot about long-term effects of the vaccine. Vaccines are relatively safe, but you have to weigh the good with the bad. Like, do you want to take the risk of having long-term sequelae from actual disease, or from a vaccine, which likelihood of having long-term sequelae is almost 0 to none?
Okay, so the questions keep coming. How did you feel from the second dose? Did you have Moderna or Pfizer? And yeah, and the flu, did you have the flu symptoms that people are talking about?
I must have been one of the lucky ones, because I had no symptoms other than, like I said before, my arm was sore. Now, the second time around, there was a little bit of a delay on my arm being sore. I didn't actually feel it until like Saturday. It just felt like all of a sudden somebody punched me in the arm. But today I'm fine. I don't have any symptoms. I feel as best as I've ever felt. So I'm really happy that, I didn't let my initial hesitation stop me from getting the vaccine.
All right, one more, sorry. Allergic reactions, conspiracy theories. Can you speak to either of those?
So what kind of allergic reactions? Or Can you be more specific? Usually allergic reactions that happen from anything in the environment that's external to your body happens immediately within like the first 15 minutes. So that's why we observe people for 15 minutes to a half hour. Because if anything's going to happen that's like an anaphylactic type reaction, it usually happens almost immediately. I know I've seen some stories about Hank Aaron. He received his COVID vaccine, and then 2 weeks later, he passed away. The man was 86 years old. They're saying that he died of natural causes. He passed away in his sleep. So they're not associating his death at all with the coronavirus vaccine.
Thank you. Let me pass it to Sarah now. Thank you so much. And of course, please stay on.
Okay, I have a couple more questions about the vaccine. Sheena, I know you already spoke about this, but I think it might be helpful to reiterate since folks seem to have a lot of questions about getting the vaccine at FPCN. Can any staff go to FPCN and register to get the vaccine? And if someone does make an appointment to go, do they need to have proof that they are in group 1A or 1B?
Okay, so at this time, all registration, you need to register before you go. So if you did not receive a link, reach out to me so I could give you the links to register for that. I think that answered the first question. The second question, do you have to show proof that you're you do not have to show proof when you, Nina, correct me if I'm wrong, you don't have to show proof that you're in a specific phase when you go in after you register and go to get the vaccine. So let me be clear about this. Initially, we make every effort to get the vaccine registration out there to our most vulnerable populations in the 1A, 1B category. So these are our frontline staff, these are our consumers, these are people in the highest risk categories. We have a window in time in which we have to get our registration information over to FPCN so they can register everyone in their EHR system. So if our registration does not fill up in a certain amount of time, we then made the decision like this morning to open it up to all staff to be able to register. And that's so no doses are being wasted. The last thing we want to do is waste any doses of the vaccine because these are extremely valuable and limited. So I want to make that kind of clear. So at this point in time, we opened up the 3 sessions. There's one on Wednesday morning, one on Wednesday afternoon. I believe the Saturday session is full to all staff at this point who are able to come to the area to get the vaccine. So I hope that answers your questions.
Thank you. Someone else said that they are getting the vaccine tomorrow. Do they have to submit results to anyone? Or I guess I'm assuming they mean their vaccination card.
Yeah, I'm assuming that they're not getting it through FPCN because our sessions are Wednesday. But so you're getting we're not requiring anyone to submit their proof of vaccinations at this point. I don't believe, but please correct me if I'm wrong, someone. I don't believe any regions, funders, local governments are requiring that as well. It's completely optional. If you want to come into your supervisor and let them know that you had the vaccine, add it to my file, add it to my chart, you can absolutely do that, but it's not required.
I can keep going. Does anyone else have anything they want to add to that?
I would just share with the community that, in terms of tracking or identifying who has and who hasn't received the vaccine, our consumers as well as employees, as what has been shared thus far, is in terms of there's no requirement, but we're also understanding and seeing that eventually that might be something that we may want to do, need to do, be required to do. So right now we are remaining flexible as the larger country remains flexible in terms of what's required and what is not. we recognize that, there is some writing on the wall that eventually we may need to identify within our populations who has and who hasn't. I think for our consumers and the folks that we support, we're already maintaining much of their information within our electronic health record. Adding whether or not they've received the vaccine might be a logical next step, but there's also an approach that we want to consider that Sheena and team are evaluating as well as we move forward. So know that we hear the question, and it is something that is being actively discussed, not just within RHD, but in the larger community as to what should or shouldn't be done as everything continues to evolve. Thank you.
Thanks, Marco. Sherry, I can keep going.
Sure.
Okay. Someone asked, is it okay to receive the second dose of the vaccine earlier or later than the window of 28 days? And this person is someone who got their first dose through an organization that is no longer providing second doses. And their second dose is 25 days. So they're asking about that window. I don't know if.
So it depends on, okay, so what vaccine was it? Because that's going to determine.
They were
where
not
need to
clear.
go.
They were not clear in their question which vaccine it was.
Okay, so the
Moderna. Sorry, they just told me Moderna. It's
okay, so if it's the Moderna vaccine, we're looking into ways to accommodate those people here at FPCN. You shouldn't get it any earlier. It needs to be 28 days. But the research suggested it can be given as late as 45 days after the vaccine and still be effective. So.
Thank you.
While you're there, hold on, Sarah, there's another question sort of similar. So in Delaware, we're having an issue getting the second dose. Can we come to Philly to get it at FPCN? Sorry, Sarah, I just figured kind of similar.
Yeah, you're right. Thank you.
I would say if you fall into those categories, yeah, why not? You just have to make sure you bring your vaccine card with you as proof that you received the first dose.
Doesn't matter which they got, Moderna.
So it has to be the Moderna vaccine because we only have Moderna. The vaccines are not interchangeable. So if you had the Pfizer vaccine, you have to find somewhere to get the Pfizer vaccine.
If this applies to you, could you please reach out to me directly? Don't register with the registration. If this applies to you, please reach out to me directly.
Thank you, Sheena.
Thanks, folks. Someone else in the chat asked, said, so once you have the vaccine, you never have to have it again?
So far, that's what they're saying. They don't think there's a booster dose, but more research has to be done because this is a new vaccine. So we have to wait and see where the chips fall. But as of now, they don't think so.
Okay, Sherry, that is all I have on my end.
All right. And that takes us through all the ones in the chat too, correct, Sarah? Or you're going to repeat?
One person specifically asked Nina if she had the Pfizer or the Moderna.
It's the Moderna, the one that we offer here. I got the one that we give. Our trusty MAs gave me the vaccine here at our site. I trust them. You should too.
All right. So before I turn it over to Marco for closing remarks, I do want to announce that we will not have a COVID-19 town hall next week. So mark your calendars that we won't have it. I'm sure we'll send out a reminder that that one is canceled. And let me turn it over to Marco for closing remarks.
Thank you, Sherry. And thank you everyone for sharing such important information today. I just received a text from somebody. I'm not quite certain who it is because my contacts aren't linked back up to my phone yet. That Nina, Sheena, you are amazing. And I just want to echo that as well. Nina and Sheena, you are amazing in terms of continuing to move our process forward. And your can-do attitude, Nina, is incredible. I appreciate it. So, you know, let's remember what both Sheena and Nina share with us today. That, you know, our health centers within RHD are providing vaccines to the most vulnerable populations in Philadelphia, our staff, our consumers. So it behooves us to make sure that our staff and our consumers within Philadelphia that we would consider to be the most vulnerable, that they are afforded the opportunity to get the vaccine at our health centers. And, you know, Sheena's definition of Philadelphia was a great definition. If you could get to the clinics, you're Philadelphia. So don't think that, you know, you live outside the borders of Philadelphia, that this doesn't apply to you or to your consumers. If you can get to the clinic, you're in Philadelphia. And correct me if I'm wrong there, Sheena or Nina.
RHD is located in Philadelphia, and we work for RHD or receive services from RHD.
There you go. There you go. So let's ensure that our staff and the consumers that we would identify as being the most vulnerable are given this opportunity. And as the opportunity exists for other staff to participate, Sheena will obviously make us aware of that, and others can jump on board as well. I don't want us to forget what Brian shared with us earlier in the call. It was almost an hour and a half ago, but it was very important for us to stay vigilant around the 4 W's, even though we are talking about vaccine, even though we are within the organization starting to see many, or some of our staff and the folks we support receive the vaccine. Wash your hands, wear a mask, watch your distance, and wait on gatherings. We must practice the 4 W's along the way. You know, I'm not sure about all you, but I know I'm ready for a Valentine's Day dinosaur party. And I really want to thank Cynthia for sharing her innovation and creativity, that OTL. What an awesome name for an RHD program, Outside the Lines. What an awesome name for an RHD program. So I want to thank Cynthia for all of the insight that she shared around what the wonderful work we're doing up in Boston. And finally, and forgive me if I forgot somebody, but the awesome work of our clinical team and our outcomes team and our program ops, and really evaluating and assessing what our participants need as it relates to COVID. Really appreciate all the effort that went into those survey results today. A lot of good information to take away. So I thank you all for bringing all this great information to us today. I thank you all for participating. And I will leave you with some words of wisdom, not from me, but from the care package that Susan referenced earlier in the call. Some of us, I think most of us, received hopefully a care package at the end of last month. And here are some words of wisdom from Carl Bryan. Don't know who he is, but he said these words. Taking good care of you means the people in your life will receive the best of you rather than what is left of you. So with that, I thank you all again for all that you do, and I thank you for joining us this afternoon. Have a great day.